Good afternoon, everyone. Do you hear me?
Yes.
Right.
Yeah, hi. Yeah, we can hear you.
I hope you're all doing very well. Let's start our today's session. My name is Dr. Avinash Bakhtiarpuri, and welcome to our Tele-Geriatric Research Fellowship session. And I'm going to introduce Dr. Rayan. She's going to lead the team today. Dr. Rayan, are you ready?
Yes, I am. Thank you for the introduction. Assalamu alaikum, everyone. I hope you guys are all doing well. So my name is Rayan Hassan. I'm the leader of the Yellow Team. I'm just going to go through the agenda of today's meeting. So the first topic we have is cancer screening, colon cancer. This is going to be presented by Dr. Syeda and Dr. Amna. Next, we're going to do a tutorial on family tree. So it's a platform that allows you guys to build on your family tree. And then we're going to preview a previous recording on a Microsoft PowerPoint demo. And then we're going to end off with mock interviews, okay? So I'll give the floor to Dr. Syeda. You can feel free to share your screen.
Hello, good evening. Can you see the screen, please?
Yes.
All right. So hello, good evening, everyone. My name is Dr. Syeda Amna, and me, along with my fellow researcher, Dr. Amna, will be presenting today on colon cancer screening. So we'll begin with that. A comprehensive overview of colon cancer screening. We're going to have a detailed exploration of colon cancer screening practices and insights for healthcare professionals. So introduction to colorectal cancer. We have to understand the importance of early detection and screening. Firstly, it helps us in identifying that there's a prevalence of colorectal cancer because colorectal cancer is among the most commonly diagnosed cancers globally, impacting millions annually. And early stage diagnosis significantly enhances survival rates compared to advanced metastatic cases. And regular screening is vital for early detection and management, thereby reducing mortality rates associated with colorectal cancer. And the World Health Organization's GloboCan database highlights the critical need for awareness and screening. So what is the importance of screening? We are going to understand the vital role of colorectal cancer screening and early detection. First of all, early detection saves lives. Localized stage diagnosis significantly boosts survival rates, highlighting the importance of timely screening. Secondly, it reduces the mortality rates, and regular screening has been shown to lower mortality linked to colorectal cancer, emphasizing its preventive power. Importance of adherence. Following the screening guidelines is crucial for effective colorectal cancer prevention and early intervention strategies. And identifying precancerous lesions. Screening helps in the early identification of precancerous lesions, allowing for timely treatments and better outcomes. So what are the various types of screening tests? First one is a stool-based test, which include tests like fecal immunochemical test for blood and GOAC fecal occult blood testing, which offer non-invasive options with reasonable sensitivity. Second is the endoscopic test procedures such as colonoscopy and sigmoidoscopy, which provide direct visualization, ensuring high sensitivity. Third is radiologic imaging, that is CT colonography, which is a non-invasive imaging alternative, balancing sensitivity and patient comfort. And last is the blood test, that is the cell-free DNA tests are emerging tools that analyze the genetic material, enhancing early cancer detection efforts. So this, I'll go over the stool-based testing overview, which is basically a key non-invasive test for colon cancer screening. The first one is fecal immunochemical test, which basically detects hemoglobin in stool recommended for annual screening to identify blood that may indicate cancer. Second is the GUAC-based fecal-occult blood test, which involves dietary restrictions prior to testing, which is also performed annually to detect hidden blood in stool. Third is the multi-target stool DNA testing, which combines DNA and hemoglobin detection for a comprehensive analysis, which is recommended every 1 to 3 years. And finally, the non-invasive screening options. These stool-based tests provide patients with convenient non-invasive alternatives for early cancer detection. So the advantages of the fecal immunochemical test are that it is a convenient and effective method. It is a single stool sample requirement. The FIT simplifies the screening process by needing only one stool sample, making it more accessible for patients. Second, there are no dietary restrictions. Unlike some other tests, fecal immunochemical test allows patients to eat normally without dietary changes before testing, promoting higher compliance. Third is annual testing recommendation. Annual testing is advised in the US for those at average risk, ensuring early detection of potential issues. And finally, this test has increased sensitivity. It is more sensitive than the GUAC fecal occult blood testing in detecting colorectal cancer and advanced adenomas, enhancing early diagnosis. So the GUAC-based fecal occult blood test, understanding the role of it, it basically requires a home sample collection, requires 3 consecutive samples collected at home, enhancing patient convenience. Annual testing recommendation, regular annual tests are advised for early detection of colorectal cancer. Thirdly, sensitivity for CRC, sensitivity ranges from 31 to 79%, indicating variable effectiveness in detecting cancer. Fourth is the impact of dietary restrictions. Certain dietary restrictions may lower participation rates, affecting the test reliability. And fourth is comparative sensitivity. This test is generally less sensitive than the fecal immunochemical test, impacting the choice. Now I would like to hand over to Dr. Amna. She will carry on with the rest of the presentation. Thank you.
Thank you, Syeda. Is my voice clear?
Yes.
Yes.
Okay. So my name is Amna Al-Had. I'm a graduate of Khartoum University, Faculty of Medicine. I will be continuing the presentation. Okay, so we'll start with the screening techniques. We'll begin with the endoscopic screening technique. It's a key method for early detection of colon cancer. There's different options of endoscopy. First option is colonoscopy. It's recommended every 10 years for average risk patient, effectively detected and remove polyps during the same procedure. Second, we have sigmoidoscopy, which is also performed every 5 years. This method is limited to examine the left side of the colon for abnormalities. It doesn't go past the splenic flexion. Thirdly, we have the direct visualization, which is an endoscopic technique that provides real-time visualization of the colon, aiding in accurate diagnosis and treatment. Fourth, we have the biopsy capabilities. Both methods allow for biopsy, enabling tissue sampling for further analysis of the lesion. That's why endoscopy is really preferred for colon cancer screening. Lastly, we have its high sensitivity. The endoscopic methods are highly sensitive for detecting the lesions, ensuring early diagnosis and intervention. Okay, so we can go to the next slide. Sure. Syeda, can you hear me? Okay. Okay. We'll start with colonoscopy, the advantages and disadvantages. Okay. First of all, it's highly sensitive. Colonoscopy detects precancerous lesion with remarkable accuracy, which is crucial for early intervention. Okay. Then we have its immediate intervention. During the procedure, as we mentioned, the polyp can be removed instantly, preventing the progression to cancer. Then it's an invasive procedure, which can be considered a disadvantage. Colonoscopy requires bowel preparation and sedation, which can be uncomfortable for the patient. The associated risk, there's potential complication from the procedure, including perforation and bleeding, underscoring the necessity for careful monitoring during the procedure. Gold standard, despite its risk, colonoscopy remains the preferred method for colorectal cancer screening, and it's the gold standard. Okay. CT colonography and other imaging techniques. It's a non-invasive imaging. CT colonography offers a non-invasive alternative for imaging of the colon, reducing patient discomfort. Screening frequency, it's recommended every 5 years, making it a practical option for the routine screening. The bowel preparation, it's required a bowel preparation, so patient must undergo bowel preparation, which is a crucial step for accurate imaging result. Okay, it doesn't require sedation. So unlike a colonoscopy, CT colonography does not require sedation, enhancing patient convenience. Okay. Its sensitivity for the polyps, it has a high sensitivity. It ranges from 67 to 94% for detecting large polyps, vital for early cancer detection. Lastly, we have the limitation. The CT colonography cannot perform direct intervention, which is a key feature of the traditional colonoscopy. Okay. We'll go over the blood test for the screening. The emerging blood test for colorectal cancer screening. It has high sensitivity for colorectal cancer. For example, we have the cfDNA test shows an 83% sensitivity in detecting colorectal cancer, indicating significant potential. The challenges with the precancerous lesion. These tests exhibit lower sensitivity for advanced precancerous lesion, limiting their effectiveness. It can only detect the cancer. Complementary rule, while promising, blood tests are not yet replaced, are not yet a replacement for traditional screening method in the practice. It's still a current research focus. There's ongoing study aimed to enhance the accuracy and the reliability of the blood test for the colorectal cancer screening. Okay. The recommendation for the screening, the initial age for the screening begin at 35. Current guidelines suggest starting the screening at age 45 for average risk individual to enhance early detection. Timely follow-up are crucial. Whenever we have abnormal test result, it must be addressed promptly with the colonoscopy to ensure timely intervention and management. We have to choose the testing methods wisely. Patients should select between a stool-based test for endoscopic procedure based on their preference and specific risk factor. Lastly, the adherence. adherence reduce mortality. So following these screening guidelines is vital for detecting colorectal cancer morbidity and mortality rates. Okay, we'll go over the strategies for improving the screening adherence. The first and most important is patient education. Educating patient about the significance of cancer can foster a proactive attitude toward health. Access barrier, addressing the barrier, whichever may prohibit the patient from coming over to screen. So addressing barriers like cost and transportation ensure that more patients can access necessary screening. Third, the reminder and follow-ups. Implementing reminders and follow-up calls can significantly increase the likelihood of patients scheduling their tests or coming back for the screening. Lastly, early detection benefits. Improving adherence to screening can lead to earlier detection of the colon cancer, which is crucial for better treatment outcomes. Okay.
Thank-
Lastly, we have the conclusion. Conclusion and calls to action. Uh, we just want to remind everyone that colorectal cancer is very crucial, and everyone should have like a basic knowledge of the procedure and share it with their patient afterward. Thank you all for listening. Hope you enjoyed the presentation.
Thank you so much, Dr. Syeda and Dr. Amna, for your great presentation. So that was the first topic. Next, we're going to go to topic number 2. This is on family trees. So I'm going to give you guys a tutorial, actually. I'll be sharing my screen and kind of going through the website and the different perks that it has, okay? So I'm just share my screen quickly. Okay. So this is the Family Echo. It's the website where you can build your family tree. So it's actually really neat. I started briefly because I always figured it's easier when I go through it with everybody. So this is myself. You can edit your details here, right? So I have my name, my surname, everything. And just to know, when you guys are doing this, it's private to you. So this is all associated with my login. No one else will have access to the information, okay? When you go to contact, you're able to add more information about each person and then biography, which is actually really neat, right? So my birthplace, my profession, my interests, activities, bio notes. So when you add the different categories for each person, at the end, after you've built your family tree, you have the option to share it. So when each individual is able to click their name, they'll be able to see all the information. So this is me, Rayan. I added, these are my parents, so Raja and Salah. When I click on my name as well, I'll have the option of being able to add my partner. So whether that's your husband, your spouse, and then it also gives you the option to add an ex, because some people may have children from an ex partner and then they have a new partner. So it's really neat in that regard. It gives you lots of options there. Next, you can add a brother or sister. So I have 3 siblings. So here it says the sibling of Rayan. So I'll be able to actually adjust the name. So Ahmed is one of my siblings. You can specify their gender, right? So for him, Ahmed is male. I put it in blue. So this goes back to the top, right? So it's adjusting the colors as well based on the genders of the people in your family tree. So what I'll do is my mom, she's colored in pink. Salah is my father, Ahmed is my brother. So it's showing you all the male relatives in color coordination as well. And then with that, you have the option of adding their contact information, going through the specific biographic aspects of each person, their birth date, etc. And then you can do their surname now and surname at birth, which is also a really neat feature. And then if I click on Ahmed, who's my brother, I can actually add Ahmed's family. So I can add if he has, for example, a partner, let me put add a new partner. So it's going to show you this is Ahmed's my brother, but this is the partner of Ahmed. I'm going to put a question mark because he doesn't have a partner yet. We'll say okay. And then you have the option of adding like a child. So if Ahmed has children or if he has second parents as well. Okay. So let's try to do the children, see where it goes. So I'll add with the kids, it's actually neat as well. So it doesn't necessarily have to be blood children, right? So here you'll have the option of adding an adopted child, a foster child, a godchild as well, a child with a new partner, and a child without a partner, right? So it gives you all these different options. We'll do, for example, an adopted child without a partner. So this is the adopted child of Rayan. Again, you can edit their information, and then even with adopted child of Rayan, you'll be able to edit it. So you can add their specific, father, partners, children, second parents, etc. And so once the family tree is conducted, you'll have the option, like I said, to edit each person, but then you can also add pictures. So you can be able to add specific pictures or even import certain icons for each individual. And then once you've finished and completed your family tree, like I said earlier, you'll have the option to being able to share it with family and friends. And then you can allow your family and friends to collaborate on your family tree. So if there's something that you forgot to add, or if there's something that you needed to adjust, you can allow them to be able to edit the family tree and add their information as well. And then at the end, once the family tree has been built, you'll have the option of downloading it and sending it to different varieties. The neat thing as well with Family Echo is, of course, every website, so this one is free, but every website will always have a premium feature, right? So the premium feature, there is a cost associated with it. So when you subscribe to the premium features, you'll have the ability to add unlimited photos and videos to your family tree, which makes it really personable. You'll also be able to create private family trees within this one, and then you'll be able to eventually add DNA reports. So there's a lot of DNA platforms, right? So 23andMe. So if anyone has gone through that, you can actually upload all that information onto Family Echo. This is all included in the premium features as well. Okay. So I advise everyone to go check it out if you guys have the time. It'll be really neat, to be able to look at your family tree and share it. Like I said, you can share it with different family members. So like whether you have aunts or uncles, they can add into it and then just kind of see it being created. Okay. So there's just a really brief tutorial on topic number 2, which was the family echo, building the family tree. The next topic we have is on Microsoft PowerPoint. So I do apologize in advance. We are going to preview a previous recording of this topic because the person wasn't able to join us today. So I'm going to again share my screen and I'm going to press play. Dr. Yaseen, he presented the Microsoft PowerPoint. He did an amazing job. So we're going to give him credit for that. And then I'm going to play it and hopefully you guys can all benefit. I'll also add his information if there is any specific questions you guys have related to topic number 3 for Microsoft PowerPoint. You guys can always relay or reach out to him, and I'm sure he'll be more than happy to help, okay? So let me just full screen it and play it. You guys can see my screen, Microsoft Rehearsal Coach tool. Yep. Okay, so I'm gonna, sorry, Dr. Avinash, did you want to say anything before I press start?
That's good.
Okay, awesome. I'm gonna press play. Thanks, team.
Okay, good. So again, my name is Yaseen Elhussein.
We can't hear the sound.
The PowerPoint.
Yes, now we can.
So the content, I'm just gonna give you
You can hear it
introduction
now?
about the PowerPoint or the coach tool in the Microsoft PowerPoint application and the benefits of using the Rehearsal tool. And I will walk you through step-by-step tutorial and live demonstration on how to do that. At the end, we'll have a question and answer about. So Microsoft PowerPoint Rehearsal or Coach tool is a feature in the Microsoft PowerPoint that helps us to practice how to present. So it's a tool it's like literally like an AI coach that will help us on enhancing our presentation skills and by providing like real-time feedback analysis for your performance and presentation. Like giving comments on how you pace your speech, how you say the words, how you pronounce, how you use different vocabulary words. And so it's generally used to improve and to practice and to rehearse before you're going into presentation. So the purpose mainly is to improve your presentation skills and build up some confidence. So what do we need to use the coach tool? As I said, we as medical professionals, we need to present sometime. We daily present, we communicate with the patients. So it's really helping enhancing the communication skills and the presentation skills. So you might present the case in attending physicians, you might present a case in conference or poster presentations or oral presentations or facilitated workshops. So generally we need an eye on us to give us a feedback so that we can improve ourselves and enhance our skills. So, but speaking about the Microsoft Coach tool, it focuses mainly on 4 areas. Like it helps you to improve and maintain an appropriate speed and rhythm for your speech, and it enhances the clarity. It will give alerts into if you're using filler words or complex phrases, like if you're using all, you have like unnecessary pauses that will be detected as well to be analyzed. You get feedback real time, so you can improve and take an action while you're presenting and while you're rehearsing as well. It will definitely boost your confidence as practice makes everything perfect. So you build your confidence throughout repetition. So it's just having someone giving you feedback at your own free time. So that helped really to boost our confidence and to have a good presentation skills. The good thing about the tool is that it gives a real-time constructive feedback, like actionable feedback that you can help you to refine your presentation skills and to improve yourself. Step by step, you just have to open your PowerPoint presentation. You have to navigate to the toolbar, searching for the slideshow, and then you have to tap on the slideshow and click, and then you will find Rehearse with Coach. Click on that. Then on the right bottom, on the right of the screen, you can click on Start Rehearsing, and then that's it. Go and speak naturally, present your presentation. Try to be like realistic. Try to be yourself. Try to present and deliver everything like you're presenting to a large audience. So at least you have realistic feedback. And then you can monitor the feedback and the analysis. Also in the bottom screen, you have you will receive a real-time feedback on the screen where you can act accordingly to improve and enhance your skills. So that's it. It's just basically AI tool through the Microsoft PowerPoint application, online or offline. You can use both. It gives feedback. And I think now we're ready to start live demonstration, how that works. I'll stop sharing my screen. I'm going to another presentation where we can start doing that. Okay, can you see my screen now?
Yes. Very good.
And it shows the clinical examination slide, right?
Yep.
Okay, so this is Microsoft PowerPoint online on Microsoft 365. And just I open my presentation. That's home. You have to go to the slideshow. And then after going to the slideshow, you can see the Rehearse with Coach. Click on the Rehearse with Coach, and then you can even enable the body language where you have also a real feedback on your body language. I have like video camera. I'm gonna click on that, and then I will just click on Rehearse with Coach. Can you see my screen now?
All good.
Okay.
Yes.
Okay, no camera access. Let me close and rehearse without camera. Okay. Okay. So today I'm going to present, you see, so I detect filler words. Okay, I'm going to present anyway, and at the end we're going to have an analysis. Try to speak a little faster. Okay, today I'm presenting slides about clinical examination. So as you all know that the clinical examination is a part of the approach that we approach the patient to reach out to clinical diagnosis. So we use clinical history taking, and then clinical examination, and then some workup on differential to list of differential diagnosis, and to perform some investigation to reach out to possible clinical diagnosis, and then to confirm the diagnosis and start the plan of management. Speak a little bit slower. Okay, so yeah, approach to the patient. First of all, you have to introduce yourself. Like, I'm Dr. blah, blah, blah. I'm the doctor working in the hospital today. I'm the doctor in charge of the case today. I'm the doctor of the clinic today. I would like to confirm your, see, try to not use too many fillers where like, Okay, I would like to confirm your name and age, please. Okay, my name is blah, 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 and I'm 37 years old. Okay. Then you have to explain the examination. Of course, you have to explain, now it will detect. So you have, so you have to explain we're going to do exactly like if I'm doing abdominal examination, you have to explain to the patient that I will do abdominal examination that will include me exposing you from the mid chest to the lower to mid thigh as well. I will have a look on your belly and I have to palpate and have to touch you. If you feel any pain, just let me know. It will not be that painful, but if there's any discomfort, just let me know. So my examination. Obtaining consent, then you'll ask the patient if you need the chaperone to be attending to the examination, and then you have to ask about the consent. Still a little too fast. Okay. So yeah, we're currently following the feedback, the real-time feedback to enhance the presentation skills. So you have to ensure the privacy of the patient and obtain a good exposure to the area that we want to examine. You have to wash your hands. Then you have to sort the examination. You'll start with the general examination for the head and neck, checking the signs of systemic diseases. There's some sign of focal disease as well. Examination methods are inspection, palpation, percussion, and auscultation. But then you have to apply those methods accordingly. So speak about head examination, that includes skull and hair examination, face examination, eyes, nose, mouth, throat, and ears examination. Skull, you have to inspect for the shape, size, to help to diagnose some syndromes in children and some neurological conditions. Here you have to look for the hair distribution, hirsutism and eyebrow, face inspection for facial expressions, asymmetry, any rashes, pigmentation, certain faces like diagnostic faces like an acromegaly, trisomy, and some thalassemia faces and so on. Palpation, you have to palpate your head, you have to take a consent for the patient. You have to explain if there's any pain, if there's any tenderness. Then you have to palpate in the head, looking for swelling, tenderness, or sinuses. And then test the face movement to test the neurological supply. So I have to ask the eye closure, lower face and mouth movement, and brows. So that's it. So when I'm ending the presentation, we're going to have a full report about the presentation, which includes 5 main areas, which we will see now. I'm going to close. Okay. Okay, there's something wrong. We ran into a problem. Not sure. Help mark design for PowerPoint. You know what's wrong? Actually, something went wrong. Let me try to. So this is from the offline. You open the presentation, you go to the slideshow, and then you find rehearse with coach. Again, it will appear, and then show real-time feedback. I'm just going to go very fast through the slides. Clinical examination. Today we're going to speak about the clinical examination, which includes a lot of things, but clinical examination is a part of diagnosis. It's help us to reach out to diagnose alongside the history taking, differential diagnosis, history taking, investigations. Approach to the patient, have to introduce yourself, to confirm the patient age, identify, explain examination, obtain consent, ensure privacy, obtain exposure, wash your hands, and then doing the general examination of the head and neck. Most likely you have to, examine the head and neck that shows sign of systemic illness, sometimes shows sign of focal diseases. Examination methods used are inspection, palpation, percussion, and auscultation. Specific head examination includes skull and hair examination, face, eyes, nose, neck, mouth, throat, and ears examination. Examining the skull and hair for shape and size, hair distribution, hirsutism, and then you have to look at the eyebrows. Face, you have to inspect for facial expressions, if there's any asymmetry, any rashes, any pigmentation, certain faces, but also diagnosis sometimes like in acromegaly, trisomy 21, and thalassemia faces. Have to palpate, you have to ask the patient. If there's any area of tenderness, you have to palpate for swelling, tenderness, or sinuses. Test face movement, brows, eye closure, lower face. So just like. So that's it. The previous rehearsal, you could clearly see that how we get the real-time feedback. I just want to show you how will the. Okay, can you see the now the report?
No, still loading.
Now, can you see it?
No, actually, I received like a blue square page.
Mm-hmm. Because it's giving me, please move this window away from the shared application. I'm not sure if it's blocking it for the confidentiality because it's like confidential. So I'm not sure if it's blocking it from the.
Yeah, I think probably it is being blocked.
But let me try again to show you a full screen. Maybe it's blocked. Okay, can you see it right now? Yes.
Yeah, it says your rehearsal report.
Yeah, it was blocked from the Zoom. So because for the privacy and confidentiality. But anyway, this is the review of the report. So it gives a summary that total time spent is 1.32 minutes and slide rehearsed were 80 slides. Then it will give a comment about using filler words. You see, like it's written that you use a lot of and so you have unnecessary pauses. Repetitive language said nice work. Your variety of words choice will help keep your audience engaged, so that's good. Inclusiveness, also great comment. Like you use like inclusive language as an excellent. Then you have a comment about the pace and the rhythm of the speech, just either slow or fast. Now it's like an average like 138 words per minute. It's all right. Just keep it up. And then it will give a detailed analysis on your average pace over time, over slides, and over the progress while you're presenting. So we'll get to know or you were a bit fast or a bit slower. And then on the right, also it will comment about the pitch and the low tone that you're using when it's get like monotonous, if it's high, if it's low, and in which slide, in which time. And then if there's something wrong, it will tell you on the real feedback, in real time feedback, that you have to raise your tone, you have to speak a little bit slow, you have to do that. So you see the track record and the progress and the improvement throughout the final report. The originality, it will give you, if you like were reading just simply the slides, like what I did in the second presentation, which was rehearsed, and then we get this report. So telling me try to avoid simply reading the slides. And then it gives actually the exact slide, which like I just read it. Or the slide you might want to work on, which just I have listed them in points without any explanation, without any extra note or something. So that's how the report works, and that's how you could have a look at your weaknesses and you work to improve them or enhance the skills. I wanted to show you that how can you use the camera on and also have a comment on the body language, but I think it's blocking. I cannot use two cameras in the same application. Not sure if that's technically able, but I've tried it before, but not sure why it's blocking. But anyway, that's work on the online version. If you have a subscription, an online account on the Microsoft, you just have to open, and then as I showed, you have to select that rehearse with body language, and that it will give you also real-time feedback on your body language skills. Like if you're like moving your head around away from the camera, it will tell you that please be centered and look at your camera. Like if you're too close to the camera, it will tell you that please come away from the camera. If you're like blocking or using your hand in front of your face, it will tell you that do not put any object in front of your face. So it will give you real-time feedback about your communication skills. If you're not keeping eye-to-eye contact, it will tell you please keep eye contact to the camera. So that's also a good area to enhance and a good area to look at for the online version. So it's summarized. It's as a summary, it's really a great tool, and it's really very excellent in self improvement and in self coaching using the artificial intelligence which built into the Microsoft. I think that's all. I'm gonna have some few questions that frequently asked, and also I'm gonna show it again. Okay. So just before we go into the questions, final tips for effective rehearsal. Just be natural. Try to speak yourself. Speak natural, like you're really presenting realists on a live audience. Please take the feedback seriously, as it's really give a really good feedback and analyze your presentation skills and use them to make any necessary adjustment and improvements. Practice. Repetition help you to be a master. So the more you practice, the better you become. Try to record and review your recorded sessions, so at least you can have a track record of your report and all of your video recording, so you can watch yourself where you're presenting after you present. So these like just basically 4 tips for effective rehearsal and coach using this tool. Okay, come and ask questions. What kind of feedback did the rehearsal coach provide? I just explained it provides real-time feedback to your presentation skills, which include the clarity of language, the pronunciation, the inclusiveness, the pace, the rhythm, and the using of filler words, and also the body language. Okay, is the feedback from rehearsal coach immediate? Yes, it's immediate. It's real-time paced feedback, so you can use it as to improve yourself while presenting. Can I use rehearsal coach for any type of presentation? Yes, you can use for any type of presentation if it's presented through the PowerPoint, Microsoft PowerPoint. Do I need internet connection to use the coach tool? You don't need to have internet connection. You can work offline as well. But you make sure that you have the like the subscription or account on the Microsoft, like the latest version of the Microsoft downloaded on your in your PC or your laptop. Is the feedback from rehearsal confidential? Yes, we proved that, right? It's confidential, it's sensitive, it's never shared with third parties, and you have your own like records on your laptop or computer. Can rehearsal coach help with language specific feedback? Not really. Not really. It's comment on the delivery style and the content, but it's not it comment on the delivery style, not rather than the content of the language. So, but however, it just sometimes offer general feedback and just I guess for the clarity and inclusiveness of the language, but it's not like for the language purpose mainly. So, is the rehearsal coach available on all versions of PowerPoints? I think it's only on Microsoft 365 subscription account. So if you have account on that, you can work on online. If you don't have, then you have to get the validated license for the Microsoft PowerPoint or Microsoft package, so you can use that offline as well. Does the rehearsal coach support multiple language? Yes, to some extent. It's available like in specific language, but it supports multiple language, and you have to check the most updated recently language also on the Microsoft website. Can it be used for a group presentation? Unfortunately, no, as still it doesn't have like a way to specify which one is presented right now, or to give individual and to give individual feedback while presenting as a group. So I advise to use it as an individual tool to get an individual feedback, real-time feedback, so you can improve yourself. So you will have a general report for all of the presentations. You cannot judge which of which. It will give you just a final feedback and a final report, unless you just want to follow the online real-time feedback. Okay, that's it. Thank you for your time. And if you have any questions, we'll be more than happy to answer. Thank you so much.
Okay, so that was Dr. Yaseen. He did an amazing job explaining it. Like I said previously, if you guys want to reach out, you can reach out to him if you have any questions regarding that. It's really good. It allows you to be able to really like check back and see how you guys are talking, especially during the interview process that's coming up. You don't want to be using those filter words, right? It'll really make a difference on whether you're memorable or not. So it's a really good platform to use. So the next topic is our final topic. Inshallah, we're going to be focusing on our mock interviews. So we have two set of interview questions. One is going to be internal medicine based, and one is going to be neurology. For today's session, I'm going to be having my video open, but the candidates won't. Hopefully in the future sessions, as the interview process continues, we'll be able to have the videos open. That way we can also, give feedback not only on the answers of the candidates or the applicants, but also on the body language, right? Because that plays a key role in, how the program director reacts to the questions as well. So, so not just verbal, but body language as well. So the first candidate or the first applicant is going to be Nusaiba. Nusaiba, if you're here, just unmute your mic. I'm going to be acting as the program director.
Hello, everyone. Can you hear me?
Assalamu alaikum, Nusaiba. Welcome. So I'm just going to pull up the questions really quickly. I'm just going to mute myself for one moment, okay?
Okay.
Okay, assalamu alaikum, or should I say hi, Nusaiba. So I'm going to be the
Hello.
program director for today. How are you today?
I'm good. How are you doing?
Good, thanks for asking. So I want to first start off by asking you a question. Can you tell me what's the most interesting book or article you've read recently that's related to medicine, and how has it resonated with you?
Okay, it's not recently, but I have read this book a few years back. It's an autobiography written by a neuro surgery resident. The book is titled When Breath Becomes Air. And in this book, the author speaks of the transition between life and death, and hence the title When Breath Becomes Air. In this autobiography, the resident speaks of his residency journey, how he sacrificed a lot of things in order to make it happen, money, time, and even the time he could spend with his family, his wife, and his children. And just when he was about to graduate from residency, he found out he had cancer. And so he began recounting the experience of being a patient after he spent years practicing medicine and viewing illness from the point of view of a doctor. It's a really beautiful book, and it taught me a lot of things, how we can see the perspective of patients and how it's very important to approach patient with compassionate care and with empathy. And it is very well written, and it depicts the transition from life to death in a very poetic and very beautiful way.
It's great. So continuing on, it seems like this book has really intrigued you and seems like you have a lot of passion. Can you just kind of go on and talk to me more about how your passion for medicine has evolved throughout your medical education?
First, the spark that fired my love for medicine came from my mother's dream. She has always wanted to be a doctor, but unfortunately she couldn't. So when I was a child, and when I knew that, the idea of being a doctor just grew into my mind, continued to grow within me until I was enrolled into the top institution in my country. And ever since I was a child, I was fascinated with problem solving and critical thinking, solving puzzles and playing card games. I really loved anything that would mentally challenge me. And that is why, starting from my third year of college, I grew enchanted with internal medicine. And I found that no other specialty would ever quench my thirst of being mentally challenged.
Okay, that's really good. So it seems like I said, yeah, you're passionate about internal medicine. Can you talk to me about a specific case or a specific patient that has impacted you in regarding your experience throughout? And tell me about, how did that experience shape your approach to patient care?
Okay. I completed my postgraduate transitional year in Sudan, in post-war Sudan, actually, during the worst humanitarian crisis. And we worked in a setting with very limited resources, and that was truly challenging. It taught me resilience, adaptability, and so many things. Actually, I remember one case when I was rotating in the surgery department. There was a woman who came to the emergency department complaining of just a pain in her leg. A few days later, we found out she had necrotizing fasciitis, and when we did the laboratory test, we found out that her hemoglobin A1C was very elevated, but she had no idea she had diabetes, and unfortunately, she had to lose her leg. That case was very impactful for me. You know the saying that prevention is better than cure. It is cliche, but it is very true. I never realized the importance of this until I saw that case. I mean, a woman came to the emergency department just complaining of pain, but she went out with only one leg. So I realized how in the rural areas of Sudan, we have no screening programs that actually advocate for screening, especially for these deadly diseases like diabetes and hypertension. And I thought about the impact of such an intervention if we ever implemented in our country.
That's really interesting, and you know, medicine is very different depending on where you're practicing it. So I kind of want to continue with the case that you just spoke about. It seems like, you know, you've had to adapt. Can you talk about how your adaptation regarding your clinical approach has changed, especially based on like new information and changing circumstances, as well as the different techniques that are being used, like the new techniques in medicine? So you're focused here in North America is mostly prevention, whereas, you know, in Africa it's curative. How has that challenged you, and what steps?
I'm sorry, I couldn't hear the question. Can you repeat it?
No worries. So my question to you is, there's all these different challenging cases. What steps do you take to find the answers when not necessarily, you know, preventative medicine is available to you?
I think the first step every physician must take is looking at the history over and over again carefully, making sure that no detail has been overlooked. So I always make sure to interview my patient very carefully and to pay attention to every detail. The second step comes the clinical examination, and you know, paying attention to everything that could be found during the examination. I also approach my patient with an open mind, exploring all the possible diagnoses, no matter how rare they seem. And, you know, as I learned from my professor, it's always a priority to exclude the most deadly possibilities first. Then we could explore the other options.
Okay, that's great. I have a question regarding team dynamics. So say you have a colleague and or you disagreed with a colleague about a patient's management plan. How would you handle that situation?
Well, that's indeed a tough situation, but I think the key to that situation is always to listen first. My first approach would be to listen to them, and I wouldn't just deem that their input is invalid or they're not, you know, not correct. So I would first listen to them carefully, explore their mindset, and then I would discuss my point of view with them and try to reach an agreement. However, if that was not possible, maybe we should, you know, present the case to some of our seniors, like the attending or the senior resident.
That's great.
To have a better judgment.
Okay. So a lot of patients that come into the hospital, they're not necessarily familiar with certain medical terminology. How do you ensure that your patient fully understands their treatment options?
Yeah, this is a very important question. I think the first step is to use very simple language, especially when we address patients who are not educated enough. So I always make sure to use simple lay language and avoid any medical jargon. And I think the most important step in teaching my patient is using the teach back method. Because some patients may seem that they are they understand and that they're following with you, but when you ask them to teach you back, you find out that they're not following anything at all. So this is very important. In addition, I would, you know, utilize other means like writing notes, phone follow-up, and other things.
Okay, so as an intern, you're going to be juggling multiple responsibilities, right? What strategies? What strategies do you plan to implement to manage your time effectively?
Well, I think the first thing is prioritization. I must prioritize my task in order of most urgent and then least and the least. I would also make sure to delegate the tasks to my team members so we can manage all the tasks in a time-effective manner. And, you know, I always love utilizing checklists and to-do lists. They always make me manage my time and my skills effectively.
Okay. So I want to talk to you about ethics and decision-making. How do you balance patient autonomy with clinical recommendations when they conflict?
Well, for sure, this is one of the toughest situations we encounter as physicians. But as I said earlier, I think the first key is to listen. It's very important to listen to the patient perspective, their concerns and their point of views, to understand why they would, disagree to our recommendation. And maybe when we address their concerns, they would feel more confident in following our recommendations. So this is the most important thing. I would like to walk them through my recommendation, listen to them, and find a solution to everything, all of their doubts, all of their concerns. But if I ever reach a dead end, I know that eventually I'll have to respect their autonomy.
So medicine is ever changing. If you could introduce one change to the way internal medicine is practiced today, what would it be and why?
I'm very enthusiastic about artificial intelligence, and I think the implementation of AI tools in the practice of medicine in general and internal medicine in specific would revolutionize medicine. Recently the use of decision support systems and all of these algorithms to help decisions make more precise decisions, avoid errors, and do them in a timely manner. I think in a couple of years, the practice of medicine would pretty much be very different with the utilization of artificial intelligence.
Okay. So, reflecting on your journey thus far in medicine, what is one lesson you've learned about yourself that you believe will make you a better physician?
I think what is as much important as our knowledge and our clinical skills is how we approach patients. Throughout my transitional year, I really could see the importance of approaching our patient with empathy, understanding, and the importance of communication and listening. I have worked with physicians who would shout at patient and speak to them in an arrogant way. And I worked with other physicians who would take a seat on the floor to listen to patient, and I could see how different an impact each of them made on their patient. So I think if there is one thing I cherish in myself and I really think would make a difference in my career as a physician is the way I learned that listening, communication, empathy, and all that kind of stuff would really make a difference in the lives of our patients.
Okay. Thank you so much, Nusaiba. Is there anything else you'd like to share about yourself, or do you have any questions for me?
Thank you very much. And I was really glad to have this interview with you. And I look forward to joining your program soon.
Thank you. So that ends our first mock. So this mock was more altered towards internal medicine. If there's any questions that the audience have, you guys can feel free to share. If not, our next mock is going to be more neurology based. And just note, like, the questions that I'm asking are more just general. When you guys do go into the interviews, dependent on what program and what university you're applying for, there may be specific questions related to that specific program. So, also focus on that, search the website, make sure that you guys know their mission plan and everything like that, just in case they do ask you the questions, okay? So our next mock applicant or interviewee is going to be Sarah. Are you here, Sarah?
Yes, I'm here with you.
Okay, perfect. Let me just open the question.
Is my voice clear?
Yes, it's nice and clear. Okay, sorry, just a moment, guys. I'm just opening up the questions. Okay, so today we're going to do a mock session for an applicant who is applying for internal medicine. So hello, Sarah. Thank you for joining today.
Thank you for having me. It's my pleasure.
Perfect. I'd like to first ask you to just introduce yourself and tell me what sparked your interest in neurology. You can
Okay.
share an early experience that you had or anything you want to share. Go ahead.
Okay. My name is Sarah Al-Awad. I'm a person with a diverse cultural experience. I was born in Saudi Arabia, where I studied my primary school there, and then returning to Sudan, my home country, to study medical school at one of the leading university in my country. What drew my attention and make me connected with neurology in real life is that I was lucky to join the Wood Research Group and chaired a clinic during my third year of medical school, where I get to shadow Professor Abashir Hussein in the clinic. This gave me a great exposure to patients with different neurological condition. I was part of this clinic, and I used to take history and do a clinical examination and counseling of patient with epilepsy, with migraine, and many other rare conditions that are like tuberous sclerosis and so many other conditions. Seeing the impact of my counseling and my listening to patient and understand their concern and follow them the next visit, and seeing the impact I made in their life, seeing them better and able to function, not like the visit before, really ignited my passion for neurology. And yeah, this is what drew me, and I cannot see myself in other specialty other than neurology.
Okay, so I want you to speak further about your qualities that you possess, and how do you think that they're going to be essential for a successful neurologist in the future? How do you embody those qualities?
Okay. First of all, a good doctor is a good observer. But in neurology, it's really important to observe with the patient from the time he entered the clinic, his walking, his hand movement, and everything. So yeah, being a good observer. And second thing, good listening. Many neurological condition is diagnosed usually clinically. We don't need to run a list of investigation and ordering a lot of expensive imaging and so on. Many conditions usually from what the patients say, and we connect it with the thorough examination, we can reach to the diagnosis. So during my time at the clinic, being in a close quarter to patient and listening to them, and watching every detail, and from entering the clinic and their behavior, and this what I think is really great, a great character of neurologist, being a good listener and a good observer.
Okay. Can you please share an experience where you felt like you made a significant impact on a patient with a neurological condition?
Okay. In Sudan, the last year, we have a conflict, and this conflict prevent a lot of patients from reaching the clinic and to, connect with their regular physician. Our neighbor was suffering at that time from recurrent attack of epilepsy, recurrent attack of seizure, I mean. She was not able to function at all. She was having a seizure and being at bed all the day. My part was I was listening to her concern and to her family what has changed recently so that her condition worsened. At that time, I come to realize that she wasn't taking her medication as she used to be due to the stress at that moment, and she is not sleeping and staying up at night. These yeah, from connecting these word, these are the common trigger that can lead to even a worsening of the condition and developing status epilepticus and even death. So I try to explain to them what should be done, and even try to connect them with available doctor online. After a few days, her condition greatly improved, and yeah, she became able to walk up again and doing her usual daily activity. Yeah, that sounds great.
So in this case, the symptom was clear. So neurology can be very complex. Explain to me how you would approach a case where the symptoms are not clear or not typical.
Okay, this is really important to listen. Yeah, the most important part is to listen to the patient and his family. Many of neurological condition are not um, usually the families can notice small details that the patient even not understand or not aware of. So listening to every detail from the family and the patient can enlighten you to reach the diagnosis. And also, we can, thorough history. And if you still everything is not clear, we are in neurology working in teams. Team of other doctors and our attending physician. We usually discuss the condition, and usually after a thorough discussion and connecting a different part of the history we reach to the diagnosis.
Okay. So within medicine, we allow other specialties to work together. So can you tell me a time where you collaborated with other specialties in managing a neurological patient? And within that, what role did you play?
Okay. Being part of Dawood Clinic allow me to collaborate with the great physician. Many of the neurological condition have psychological aspect. In Sudan, there is a stigma about epilepsy and many other neurological condition, which put the patient at stress and lead to development of psychogenic non-epileptic seizure, which is a condition that's due to the stress and due to stigma usually develop. So at the clinic, when the clinical presentation of the patient is not characteristic of the true attack, we usually send him to our psychiatrist at the clinic, where they get more assessment, and then he returned back to us. So this collaboration between psychiatry and neurology at the clinic allow us to reach what can be the trigger for his condition. Yeah, and second scenario where I was a part of is patient having symptoms suggestive of Wilson disease. He has a lot of symptoms, but at the clinic, we are a small clinic. We usually send our patient to ophthalmologist and to reach to read the final diagnosis and then come back to us. So to manage the condition, the neurological part, So usually we work with a lot of doctors.
Okay. So medicine is not necessarily just, the physiology. There's also a lot of research that goes into it. Can you talk to me about a research project that you've been involved in related to the field of neurology? And from that research project, what insights did you gain from?
Yeah, okay. I was during the period of COVID-19, I was part of a case report of the association of myasthenia gravis and COVID-19, and even the vaccine, AstraZeneca vaccine. We have 3 patients. Yeah, it's a case series, and we follow 3 patients who develop. One of them had exacerbation, and one has developed a new myasthenia gravis after COVID-19 infection, and the third one developed the symptoms after AstraZeneca vaccination. Yeah, this give me a great insight into how different conditions are really connected, and we should dig deep in the history and yeah, to connect what can happen, what can condition trigger, and how the condition can be triggered. Yeah, that's it. And another research I was part of is the knowledge, attitude, and practice of Sudanese doctor toward epilepsy. Yeah, in this research, I was part of inception, the idea, and even the data collection. I During this period, I get in contact with a lot of physician. After that, we get to know that the experience and the length of time in the doctor are practicing give them more knowledge and more and better attitude. So we try to deal with this by organizing many symposium and many conferences to give more information to doctors. So I really see that researchers put a real impact in neurology and management of condition.
Okay. As physicians, sometimes patients or patient's family may reject certain recommendation or treatment plans. So how would you approach a case where a patient's family disagrees with your treatment plan
Yeah.
for your patient?
Okay. Yeah, this is one of the situation I faced in our clinic, where the family refuses to give specific medication because, yeah, it's a female, and they see that those who take this medication usually lose their hair, they cannot conceive, and a lot of bad side effects. So, at the start, we try to listen and to know what their concern with regard to why they refuse this medication and our treatment option. And then we come in consensus with them after knowing their concern, and we change the management to be better with their wishes. Yeah, I think the good listening and being in a conversation, not imparting or yeah, just this and go is a better approach.
Okay. So there's a lot of different fields when it comes to neurology. Is there one particular sector or area that you're most passionate about? And how do you plan to explore that during your residency?
Yeah, I was neurology is really great field. There is a lot of condition that passionate me, in fact, but I see but epilepsy and yeah, I face a lot of patients with epilepsy in Sudan. So this put in me the I want to search more. I want to explore more about what other management. As I read in the literature, I discovered that how the role of artificial intelligence and even the genetic therapy and the new modalities of CRISPR-Cas9 and a lot of other methods are there for managing the epilepsy and allow them to avoid the medication and the bad side effect from them, and the necessity to take the medication for 2 years, which was struggling to many patients in my country and a lot of other and over all the world. So yeah, I see myself exploring more and finding more and doing more research in epilepsy in the future. so as I will be able to pay back to my community and give them more better ways to manage this condition.
Thank you so much, Sadra. Is there anything that you'd like to share that we didn't or haven't necessarily touched on?
Yeah, I really interested in your program and the different part of neurology you are giving to resident, and especially the wellness, and focusing on the wellness of the resident in your program was really make me really interested. Thank you. I hope you choose. I will be part of your program.
Okay, thank you so much, Sadra.
You're
Thank you to both Nusaiba and Sadra. You know, one thing that I noticed from both of their interviews, and you know, please include you guys, like if you have any feedback for any of them. So as program directors, they initially look through your CV, look through your account, they offer you interviews. But when you're being interviewed, you know, they may not necessarily know everything that's written on your CV, right? So out of all the questions that were asked with Nusaiba and Sadra, what they did is they were able to provide examples. They were able to, you know, answer it based on their experience. So they kind of just pretty much, you know, not necessarily memorize their CV, but they knew what their CV had, and they were able to talk about that. So I think just as a pointer, you know, make sure that when you guys are answering questions, you know, bring examples, talk about your experiences, talk about things that you have done, things, you know, that challenged you, and don't be scared to ask questions back. For me, I asked Nusaiba a question, she didn't necessarily hear it or understand it, so she asked me to repeat it. And yeah, so thank you guys so much for tuning in today. That concludes our topics for today. I'll pass it to Dr. Avinash.
Thank you so much. It was a nice presentation. I would like to share my thoughts on each presentation. Thank you so much for Dr. Syeda Amna and Dr. Amna for sharing the guidelines on the colorectal cancer. And I would also like to share the timeline of the colorectal cancer screening guideline, you know, when to start, at what age we can start the screening, and at what age we can stop it. So according to the American Cancer Society and the US Preventive Service Task Force, it's recommend beginning the screening at the age of 45 for the people at average risk. But the screening can start earlier, before the age of 45, for the people with certain risk factors like a family history of colorectal cancer, genetic disorder, for example, Lynch syndrome or IBD, ulcerative colitis, Crohn's disease. And the age, I would say, when we can stop the screening, it maybe we can discontinue after the age of 75. But again, depending on the individual health status and previous screening results. So, but the screening is generally not recommended for the individuals over 85-year-old, particularly for the colorectal cancer. So yes, that's a great presentation given by the Dr. Syeda and Dr. Amna. And again, I would say the PowerPoint coach, which is presented by Dr. Yaseen, I believe this is the best tool where we can enhance our presentation skills. And I would like to thank you also, Dr. Nusaiba and Dr. Sarah, for participation in the mock interview session. It was a great experience, and I hope it gave you all a realistic sense of what the residency interview process is like. A few thoughts I would like to share for the applicants that I would say, like, you did a fantastic job with your response. I noticed there are strong examples of your self-awareness and how you conveyed your motivations very clearly. But always remember that your answer should be aligned with the program's mission and demonstrate your unique strength. And for the Rayan, you played a very well role on the program director. Your questions were, you know, very thought-provoking and challenging, which is exactly what we expect in a real sense scenario, these challenging behavioral questions. And you helped us creating an authentic atmosphere, allowing us to applicant to think critically and stay composed. So yes, I would like to Thank you, everyone. And if anyone have a question, you can guys ask. Or any updates on research project or any ideas about the research. And if anyone need help or any question on your Eros application, I'm going to share my email ID. You can reach me out there. I will try my best to help you guys.
Thank you so much. I just wanted to ask, what would you advise us to work on to enhance our interview skills?
Interview school, again, the only one thing is that practice with your friends, with your colleague, and get feedback. Feedback is very important. And there are now, I believe, some artificial intelligence tools came. If you don't find any colleague or partner, you can practice yourself on your laptop with these AI tools. Definitely, I will share next time once I get the names. I can't remember the name at this time, but I will share it with you. So practice is the main thing.
Thank you very much for this great advice.
You're welcome. Any other questions? Or we can conclude our session today. So yeah, again, I would like to thank you, Dr. Syeda Amna, Dr. Amna, Dr. Rayan, Dr. Yaseen, Dr. Nusaiba, and Dr. Sarah. Thank you for today's presentation and mock interview. And I would like to thank all of our presenters and our listeners who joined today's meeting and your participation. I look forward to meet on our next meeting. Thank you so much.
Thank you so much, Doctor.
Hello. Do you hear any voice? I don't hear anything.
And had lights on it. Mom, you can just push it up and had lights on it.